And we will get started. So good morning for those who are joining us, and I'll be adding more folks as they pop in to our waiting room. My name is Lynn April, and I am with CESA 8 with the Education for Economic Development Center. And we are, along with CESA 7 and the Ahnapee Youth Apprenticeship. Oh, somebody has their sound on, so I'm getting some feedback. The Ahnapee Youth Apprenticeship Consortium, UWGB, NWTC, and Inspire Northeast Wisconsin, and we are sponsoring these virtual job spotlights through the month of November, specifically in healthcare. So today we have a special event to kick off before our regular event, and that is a deep dive into healthcare careers with our guest, Ken Nelson, who is the Chief Nursing Officer at HSHS. So just a reminder that immediately after this at 9:45, we will shut the meeting down, but we'll use the exact same link to come back at 10 o'clock for our 3 virtual job spotlights. So we'll be hearing from Dr. Adam Eicher, who is an ER physician, April Flynn, who is a certified dental and orthodontist assistant, and Jason Helgeson, healthcare administrator and VP of clinical operations with Prevea. So just a little reminder of our norms. The meeting is being recorded and will be broadcast through Inspire Northeast Wisconsin after the event. Everyone is muted and the video capabilities are turned off to minimize distractions. I'll be sharing my screen and the slides that go along with that. So you won't need to worry about that. If you do need to leave the meeting, I will keep an eye on the waiting room. So I will try to let you back in, but just not a guarantee that you will get back in. But we absolutely encourage our students and staff who are joining us today to ask questions. So please enter those through the chat. Allison from NWTC is going to be manning that chat, and she will share your questions with Mr. Nelson as you ask them. And we don't anticipate needing to do this, but we do have the ability to remove anyone from the meeting if they become distractions. So without any further ado, I will turn this over to Ken Nelson from HSHS. Thanks so much for joining us.
Well, good morning, and thank you for having me. And hopefully I won't become too much of a distraction so I don't end up getting removed before I'm done. But you can go to the next slide. As April said, my name's Ken Nelson. I am the Chief Nursing Officer for HSHS St. Vincent Hospital and HSHS St. Mary's Hospital, a medical center here in Green Bay. Also, not assistant professor, I guess would be adjunct instructor at UWGB as well, teaching in their healthcare management track. So I'm very delighted to be here. What I'd like to do today is spend a little time talking about nursing and then sort of weave, I guess, my career path into that, because I think there's hopefully some nuggets there that people can learn from, either what to do or maybe what not to do along the way as well. I'd also like to talk a little bit about HSHS as well, because we are pretty deeply rooted in Brown County and the surrounding communities, and then leave ample time for questions. I think that the richness of any discussion like this really comes from what all of you would like to hear along the way as well. So, well, I'll start out a little bit about me then. So I'm a nurse. I've been a nurse for 21 years. Nursing was not my first career choice when I got out of school. After high school, I grew up in Antigo, small town, and after high school, I went down to UW-Madison with the intent of pursuing a medical degree. I wanted to be a physician. And that did not pan out. And so I moved back home to Antigo, and I was, for a while, probably the best bartender around. So that was my, kind of what I was doing, is trying to figure out what I wanted to do. My mom's a nurse, my grandmother was a nurse, and now I have a sister and a cousin who are nurses as well. So that medical kind of runs in our family. So anyway, as I was back home living with my parents, my mom came up to me one day and said, hey, the tech school, NTC over in Wausau, doesn't have a waiting list for clinicals this next semester. This was back in '97. And I kind of looked at her and I said, oh, and she looked back at me and she said, well, it's this isn't a choice. It's not an option. So I was enrolled at NTC up in Wausau, which is where I started down the path to become a nurse. So my first degree in nursing was an associate's degree in nursing. So I think the first thing I learned, and that maybe some of you can take from this, is that you can start down a career path through many different ways. And I think that the technical route was a great way for me to start in nursing. So then I took my first nursing positions down in Milwaukee at a 900-bed hospital, and learned all there was to know about cardiac care. Went back to school, got my bachelor's in nursing, and then subsequently I've completed my master's degree and my doctorate degree, my doctorate of nursing practice with emphasis in health systems management. I got master's and doctorate at Vanderbilt University. Along the way there, I went from Milwaukee to Madison, and now I've been here in Green Bay for about 3 years, 3 years this week actually, in this position. So a little bit along the way though, I think it's important to understand that kind of the great thing about nursing is there are so many different opportunities and options. I mean, I went from being like a med surge type nurse. Then I got into cardiac care. I took care of patients that had heart transplants, lung transplants, artificial hearts. And then I worked cardiac ICU, both surgical ICU for cardiac as well as medical. So got to see a lot of really interesting things, got to help a lot of patients along the way, and made a lot of good connections along the way as well. While I would say that starting with that associate's degree laid a great foundation for me, certainly my education moving forward has been key to the accomplishments and achievements that I've had along the way as well. Without that solid theoretical foundation that I've developed along the way, I wouldn't be sitting in this position today. So in my current position as the Chief Nursing Officer for St. Vincent and St. Mary's, I have oversight for the nursing practice at both hospitals, and really the accountability and responsibility for about 900 nurses at both facilities, and all the things that go along with that. So it's a very humbling to think about, knowing that there is, with all the care, all the great things that are happening in all of our hospitals in the community, it's very humbling to me to know that there's a lot, there's really a lot at stake for a lot of people. And I got into nursing to care for folks. In my job now, I get to really help to facilitate that care for patients by securing different resources for nurses, whether it's more people. I do that along with Kayla, our talent acquisition, part of our talent acquisition here with HSHS. Whether it's other resources, equipment, that sort of thing. That's really my role as the really the executive representing nursing for us. So so my typical day involves a lot of collaboration with different departments, whether it's human resources, facilities, or plant ops here, trying to make sure we have great spaces to take care of our patients, making sure we have the right people here, and also collaborating with physicians and with other members of the healthcare team as well. So healthcare is definitely a team sport. I think there's sort of a perception in a lot of different, like if you see different TV shows and things that involve healthcare, I think a lot of times a lot of the other departments or disciplines, especially nursing, sort of get overlooked. But I think you would find that when you come into a hospital, if you've been a patient or had a loved one in a hospital, you would see that nursing is definitely a huge component of the care that takes place. I've also managed to come across a lot of things that I did not expect along the way with this. There's this thing going on right now, in case people haven't noticed this, it's called COVID-19, this pandemic that's happening. We in healthcare, we've really had to evolve the way we take care of patients, We've had to become very ingenious and creative in where we're taking care of patients, how we're delivering care, keeping up the highest standards of quality with just an ever evolving landscape around care. So that's prevented some challenges in many different ways. Like I said, space has become an issue, accessibility for staff and nurses. Has, you know, I focus on nursing obviously mostly, but we've seen now, just because of the prevalence of COVID-19, it's not just it's people in healthcare that are also being affected who are getting it. So we've had to sort of work around that as well. You know, and also the different treatments and things that have come out in regards to caring for these patients. In fact, just this last couple days ago, you know, two big news items came out. One was that we're getting pretty far in a vaccine, and the other one being a new medication that's being used to treat patients with COVID who are not in the hospital, getting emergency approval. So we're already way down the path as far as how we're going to be able to utilize both of those things to help treat this. So really part of this is being innovative and forward thinking while it's sort of like building an airplane while we're in the air, because things keep changing and we've had to adapt quite a bit. I also didn't expect just some of the different opportunities that I've had to really give the message around things like COVID. In the past, I've been asked to present on different newscasts. In the past, it's typically been around flu season and influenza and flu shots. This last year, I've been asked to talk a bit about COVID in our communities, even so far as being on NBC Nightly News and Good Morning America, which was completely not something I would have seen myself doing in the past. But part of this has been embracing those opportunities to help to educate the public and to help make sure that we're able to continue to give the best care that we can. So I guess that's really enough about me, I would think. Why don't we, so I want to talk a little bit about HSHS and the ties to our community. So Hospital Sisters Health System is comprised of 15 hospitals, both in Illinois and Wisconsin. We have 200 clinics, about 13,000 colleague employees. And we've also been serving in our communities for 145 years. Specifically in Green Bay, the first Hospital Sisters, the first sisters came to the Green Bay area back in 1888. There was a call from the bishop in this area looking for some help for healthcare. We're based out of Springfield, so he wrote a letter to the Bishop of Springfield and asked if there was any way that that any of the sisters would be able to come serve the people of the greater Green Bay area, growing city at the time. So in 1888, four of those sisters set out, and they left Springfield, came to Green Bay, bought a house over on Quincy Street, and started serving patients locally. And they lived basically on charity from the local community. Being very savvy, they were able to raise enough funds so that in 1895, St. Vincent was built at its present site. So fast forward from 1895 to 2020, we are now a over 500 bed tertiary medical center, level 2 trauma center. We also have HSHS St. Vincent Children's Hospital housed within the four walls of St. Vincent. So a lot has changed in the last 132 years here in Green Bay. But what has not changed is that we are focused on our patients. Patients are at the center of everything that we do. And our sisters, even though their numbers are decreasing, they very much are wanting to make sure that our mission carries forward, even as their numbers continue to decrease. So if we go to the next slide, I do want to just kind of show on a map, I guess, where we are. So you can see they're up in the northeast side of Wisconsin. The four large blue dots are the four HSHS hospitals: St. Vincent, St. Mary's, St. Clair in O'Connell Falls, and St. Nicholas down in Sheboygan. And then we also have, we are a partner with the Door County Medical Center up in Sturgeon Bay. And then Sacred Heart and St. Joseph's over on the west side of the state are our other two hospitals in Wisconsin. The green dots are all of the Prevea clinics. And then down in Illinois are the rest of our hospitals and affiliate clinics as well. So definitely a larger footprint in Illinois than in Wisconsin. However, certainly in Wisconsin, we are vital to the communities that we serve. Next slide. So I just want to make sure when I talk about our mission and our core values, respect, care, competence, and joy are the four core pieces. And the reason I bring this up here today with all of you is, so I think back to my first nursing job when I got out of school and in looking to find a place to work. First of all, I wanted to find a place that resonated with me. And now on the other side of things, what we look for when we bring, and any organization will tell you this, it's not just HSHS, whether it's here locally, whether it's Aurora or Bellin or anyone else, they're looking for people that fit into their core values and ideals around what healthcare is. So although certainly for nursing, I mean, obviously the ticket to the party is to be a nurse. What we're looking for more is having the right fit for our values. And so I think that as all of you as students move forward and think about what you want to be, it all starts with not just your academic performance, but also those other things that you do to help round yourself out along the way, different organizations you're involved in, different activities that you participate in that really help you to define who you are as a person, because we can train anyone to become a nurse, if they have a nursing degree, but what we can't train is really that core piece of what makes everyone up inside. So if you take anything away today from what I've had to say, have an understanding that it's more than just the degree on paper. It's also about what you bring with you to whatever organization you choose to go to. The next few slides, we can kind of go through. I know a lot there's been a lot in the news around you see these departments right now with COVID happening, just sort of I call them MASH units, sort of these pop-up departments, ICUs and things that, that are looking pretty, they look pretty desolate sometimes in how we're having to deliver care lately. But I just want to be clear, in our partnerships with the community here, we've been very blessed and we're very grateful for the support from our community. So I just have a few photos in here. With Ask to the Community, we've done a lot of work around improving our children's services, renovating and remodeling our children's hospital here. So this is just a couple pictures in the children's area in our ED at St. Vincent. Again, it's thanks from our community. And then the next slide, I believe, is probably some more of the same. So, and then the next slide is a picture. We also appealed to our community with some help for renovating our women's and infant services as well. And the community helped deliver on that. And so, I wanted a few kind of nice pictures because lately everything that's been seen on the news has been pretty grim. But we still, in addition to the work we're doing with COVID, we still have many patients coming into our facility still for all those other things that need to happen, and we are ready to take care of everyone. So, I guess that's kind of what I had just for sort of the quote unquote canned presentation. I'd like to open it up if anyone has questions or anything that I could clarify or anything else that I can help to offer for anyone listening right now.
So yeah, please do type in the chat any questions that you have. I have a couple. One would be, obviously, I'm sure being on Good Morning America was not something that you expected to be doing in your position, but what's the most surprising way that your position has been impacted by COVID?
I think that the most surprising, but probably most welcome, has been from the very start. So, I mean, as you're aware, the Green Bay market for healthcare is pretty competitive. If you look at HSHS, St. Vincent, I mean, Bellin is actually attached to our building, right next door here. And then Aurora over on the other side of town. Immediately when we recognized as a community that this thing called COVID was happening, we've all been coming together since March. Initially it was every morning, all the health systems and public health and outlying health systems like Door County, Holy Family down in Manitowoc, public health in Brown County and De Pere. We've all been coming together, and tribal health as well. The Oneida Nation has joined us. We've all come together. We've set our competition aside, and we've come together to serve the community as a whole. My role in that has been to coordinate with the chief nursing officers in the greater community to make sure that we now have contractual agreements to be able to share supplies, equipment, and people across all of our hospitals. So for example, we've sent ventilators down to Holy Family when they were sort of overrun a little bit, and they were smaller hospitals. So we sent them equipment. We've borrowed dialysis machines from Bellin. We've had opportunity where we've been ready to share staff, and we can do that. We haven't done that yet because I think we're all kind of getting hit there, and no one's had a lot of extra folks, if you will. But that's been the biggest surprise, that in the sort of business world of healthcare, when the community needed us, we were able to set that all aside and come together to work. So, and that's kind of what it's all about. For healthcare, it's taking care of patients wherever they're at. And it really doesn't matter who you're working for, because we're all here for the same reason.
Awesome. Just thinking about your nursing staff, how do you think that they would answer that same question? Like some things that they, obviously, I'm sure they're working longer shifts than they were before, and just the level of personal protective gear they have to wear, I'm sure is much different than they would on a daily basis. But any other impacts that they would say just in their day-to-day nursing positions?
Yeah, I think the biggest impact for all of them has been just with the surge in our community right now. We've had to really limit the number of visitors that we've had in the hospitals. That adds a whole new element to the care and how they're able to give that care. We've always, I think, in all of healthcare, we've always partnered with families. That's been our goal when someone's in the hospital, to make sure that there's someone there with them to help them to kind of navigate the process, and folks that we can also sort of rely on and talk to, and so that people understand what it is we're asking, or what we're explaining to them, or what's going to happen. A lot of that has gone out the window now, and it makes it hard. It's frustrating for patients, it's frustrating for families as well, and it's also frustrating for all of us, because we'd rather have people be able to come in so that we can partner effectively. And so now it's led to a lot of challenges with communication, with identifying who it is we should or shouldn't be talking to, making sure that we're very clear and timely in our messaging. And that every time a nurse has to answer a phone or take a call, that's pulling him or her away from the care of that patient. So we've really been working hard to kind of smooth that out and make it better. We still have work to do, and constantly it'll likely be a work in progress constantly. But I do think that that support that families can provide has been hugely missed.
That makes complete sense. I don't have a lot of background in the medical field, so I'm just wondering, title-wise, when you're a nurse and you then go and get your PhD, are you addressed then as doctor, your name, or how does that work in the medical field?
So it's largely dependent. I mean, at an academic medical center, for example, like at Vanderbilt, where I had done my doctorate work, there is at a large teaching center, there are so many people that get involved in the team, and so many different positions that those credentials and titles are largely used a lot more often, just to be able to help differentiate who's who and who does what. Traditionally, I mean, I will say, traditionally the term doctor in the medical field has referred to physicians. I typically, in my work, it's a first name basis with everybody. Doesn't matter who they are or what they do. I do have folks that address me as doctor. I find I get doctor a lot more in my role as a professor, as opposed to a CNO. I'm not, I don't rush to correct people. You know, I mean, it's not, you know, I don't know. I mean, I'm pretty, I don't know. I'm pretty confident and comfortable in, you know, my skill set and my knowledge. So, you know, but like I said, you know, it all depends on where you are. I mean, doctor is something that certainly is earned. And I certainly, you know, I take pride in the fact that I continued on with my education and got that terminal degree, and would encourage anybody to go that route. You know, as a nursing leader, you know, the idea of a DNP, a doctor of nursing practice, you know, nursing leadership is just one piece of that. There, I mean, nurse practitioners who are clinical. The DNP is also a terminal degree, as well as for midwives and for nurse anesthetists as well. So it's a, again, to me, it's a demonstration of, you know, sort of that expertise and knowledge. And then, but I also take the responsibility to share that knowledge very strongly. So I've taught at GB, I've taught at Vanderbilt, I've taught at Marquette, and then at Clayton State down in Georgia briefly. I think that, you know, again, it's just, it's to me, every degree you get opens up another door. And while I started with an associate's, you know, to me, I think that anyone who's going that route, like at NWTC for nursing, ought to have in mind where they're going to get that bachelor's degree from. We actually here at HSHS, we require that within 5 years of starting, if you have an associate's, that you complete a BSN, but we also offer tuition reimbursement and scholarships and things to help along with that. So it's just one of the benefits for HSHS.
That's great to know. That's absolutely imperative for students to know that if they start with that associates and they would secure a position with HSHS, that within 5 years, having that next degree is something that is definitely not only encouraged but required, but then there's also the support for them to get that. So that's also huge information for parents to understand, because things have changed so dramatically, you know, since back in the day when I was in school, and there really wasn't all of that support from employers. So that's wonderful. Allison, do you have more questions?
I do. So if we could put COVID aside somehow in our minds.
Please, I can't wait.
I know. So it just comes in that vein in terms of, you've been doing this for 20 some years, you've been in it. Prior to the beginning of this year, what had changed, if we can even remember that, but just the evolution for you in your eyes in terms of nursing?
So I think, so if you, and maybe people, I just take this for granted, but I don't know if people understand this. So every year Gallup does a poll of the most trusted professions in the country, and typically nursing is right at the top of that. And I think that what I've seen over the last 20 plus years is sort of an evolution of how nursing fits into the care continuum for people. Traditionally, nursing was often looked at as the person in the hospital who was doing what the doctor told them to do. If you look at nursing now, and I think some of that has even come with the evolution of the doctorate level practice degree for nursing, the DNP. You see nursing now in so many different areas. We see more nursing-led clinics. We see more autonomy in the practice of nursing. Advanced practice nurses in Wisconsin have to have a collaborative agreement with a physician, but it's not an oversight agreement. So you see many clinics that are completely run by NPs. There are midwife-led OB practices as well. You see nursing involved, if you look at more health and wellness things that employers offer, those are typically nursing-led initiatives. If you look, you know, in some of our different community level outreach, free clinics and things, typically nursing-led. So what I've seen now is a shift from just that hospital-based piece to how can nursing, how do we work at the top of our license? How do we really maximize what we can do and offer to communities? Really, if we would reach the goal that we need to with our communities and how nursing can do that, I'd be out of a job, because I think the idea here is to keep people out of the hospital, to keep people well, and to you know, help them to live their lives the way that they really want to live them, and to partner with people before they even get here. So there's been that advance in nursing. There's also been a huge advance in technology, in things that we can offer for patients. And with that comes sort of a different level of nursing care that needs to be offered. I would say that compared to 20 years ago, a lot of the patients that we may have seen in the ICU 20 years ago often are maybe a one-night stay in the hospital. And I'll tell you, the patients that I first took care of when I got out of school don't even get admitted anymore. They're in and out of the hospital in the same day. We're seen in an ER and they go home, or even urgent care for that matter. So when patients are actually in the hospital, it's because they're sick. And so we've really had to sort of change our approach on this side as well.
Another question. What has been both the scariest moment in your career, and then the happiest? So the dichotomy of happy and scared.
Sure. Well, I think the scariest moment for me was, I think that first time in the ICU on a night shift, when I had a patient that coded. Coding, is the that when they lose their pulse and they stop breathing, and you look around and there's 23 other sick patients in the unit, and you say, oh boy, this is me until I can get some help here. So I distinctly remember exactly why that patient was there and what happened with him, what led him to get there, and the circumstances leading up to that. And it was scary. But that sort of instinct kicks in. That's where the training and repetition and being a good learner from your preceptor kick in. And we saved his life. He subsequently went home, which if that happens to you in the ICU, that the odds of you leaving decrease significantly. So it was a good, but boy, it's scary knowing that you literally can have people's lives in your hands. And it's not just even in the acute phase like that. It's along the way with people. Even I talked about like clinic setting and things like that. Helping people to manage chronic diseases and things like that. You also have their lives in your hands. It's just in a little bit of a different way. Boy, the happiest moment, there's a lot of them. I think probably getting this job was, I would say at the time, was the happiest, just because it's something, it had been sort of a long-term career goal for me, what I wanted to do when I got into nursing, and kind of saw for a while that leadership was going to be the way I went. This was a big deal. I got a lot closer to home, have a pretty wide responsibility, which I really enjoy. And but I would say along the way now, even just this morning, I was able to recognize a nurse up in our ICU who she actually did save a guy's life. And it turns out, she found out after the fact, that he was a family member of her fiance, and she didn't know that at the time. And so when we told the story this morning, she started crying. Everyone started crying, and it was just kind of one of those neat moments where I could see the impact that she had made, and and that just makes me proud. So those are the things that keep me going every day.
Super. I have just one more question, and that is, from your perspective, how are students or people with disabilities able to work within your spaces?
Well, so there's a lot of different. I'm glad you asked. So as far as students go, we do have ways for students, even in high school, I believe, Kayla, don't hold me to this, but certainly right out of school and into college, we oftentimes our nursing assistants, let's say, are students coming in, and we have a process here where if you start out in a nursing assistant role and you're in nursing school, we have an extern program where we actually start your nursing training kind of along while you're in school, and then at the end, when you're going through that extern program, when you get to the end of the nursing piece where they do those capstone hours, we offer those here as not only credit for clinical hours, but paid time as well. So and we've partnered with all the schools in this area, NWTC, GB, Bellin College, to be able to offer that as sort of a dual benefit, if you will. So we really support people along the way. There's also other ways to get people to get their foot in the door, whether it's through like food and nutrition services, that sort of thing. We have a lot of students that start there and then kind of progress through like a different career path, whether it's nursing or lab or things like that. As far as folks with disabilities, we sponsor the Project Search here at HSHS. So we offer training for those folks who have disabilities, to training in different departments here, whether it's in our food nutrition services, our supply chain, environmental services, things like that. And most often when they complete their training, we actually hire them to work here too. So a lot of different ways, a lot of different inroads into healthcare. We're working very hard on the diversity here as well. I mean, I really feel that the workforce in a hospital, specifically for nursing, as well as everyone, my focus, of course, is nursing, but we really ought to be a reflection on what our community is and the folks that we serve. And so, we're working very hard to make sure that our workforce reflects the diversity in this community as well.
Awesome. So any other
Thank you.
questions, either from you or any of our students?
And kind of going off of that, I just wanted to add also that something that we have for our colleagues to grow is we actually have our own on-site CNA school. So that's eligible for colleagues that are with us that do work in food and nutrition, environmental services. So we actually put them through school to be a CNA with us. So they don't have to pay anything extra for it. It's just something that we do to promote their growth as an employee with us.
Yeah, how can I forget about that? Sorry, thank you. That's been really cool. I mean, yeah, we're certified with the state for that. So it's again another inroad for folks and another way. I mean, we really, I think part of this, is our support in this community as well. I mean, we've gotten a lot from this community, and part of this is the giving back as well. So we appreciate everyone.
And Kayla, since you answered that question, could you pop in and just say what your position is?
Yes, definitely. So I am actually they just changed my job title. So I'm the community sourcing strategist. So my main focus is campus recruitment across Wisconsin for all 6 of our Wisconsin hospitals. So I partner with different college campuses, high schools, to inform them about HSHS, to get them engaged and answer their questions and help them along their career journey once the time comes.
So if you're a student or you are a staff member and your district is interested in more information, Kayla would be the person to contact.
Yes, Lynn can get you in touch with me.
They absolutely can.
Yes.
All right. Well, if there aren't any other questions, we are so appreciative of you taking the time to be with us today, Ken, and for giving us all this great information and giving us a deeper dive into healthcare than we do during our traditional job spotlight. So thank you so much for being with us today.
Thank you for having me.
You bet. And I'm going to